Welcome to Biochemistry DSP channel. Today we'll be discussing about glucose tolerance test. Glucose tolerance test is a very useful diagnostic tool to diagnose the asymptomatic diabetes and impaired tolerance to glucose. So it's a test to determine the ability of body to utilize the amount of ingested carbohydrates, that is mainly the glucose. This test is used to diagnose diabetes. So the conditions required for oral GTT includes the person should not be allowed to eat or drink anything 8 hours prior to the test, and he should have stopped intaking all the medicines which will influence the blood glucose level. Mainly you have to stop taking oral contraceptives, steroids, thyroid hormones, etc., which will all influence the blood glucose level. During the test, the person should not be allowed to smoke or is not allowed to drink alcohol. GTT procedure. Okay. So for this glucose tolerance test, 75 grams of glucose should be dissolved in 250 or 300 ml of water, and the person is asked to drink this glucose. Before drinking, the fasting blood glucose sample and urine sample should be collected to check for the fasting blood glucose value and for the presence of glucose and ketone bodies in urine. So the main steps which are to be followed in oral GTT is actually the test should be performed preferably in the morning between 8 to 10 a.m. and the person should be allowed to drink 75 gram of glucose dissolved in 250 to 300 ml of water, and blood and urine sample should be collected from the patient at half an hour interval for the next 3 hours. That is, we have to collect the fasting sample, and at half an hour interval blood sample should be drawn, and 1 hour, 2 hours, and 2.5 hours, and 3 hours. So like that, at different half an hour intervals, blood and urine sample should be collected and a curve should be drawn. Okay, so a graph is plotted using the blood glucose values against the corresponding time interval for the fasting blood glucose value and half an hour value, 1 hour, 2 hour, 1.5 hours, 2 hours, 2.5 hours, 3 hours values. So the blood glucose values should be plotted against the corresponding time intervals. The graph from the graph we'll get a curve. That curve is said to be glucose tolerance curve. Okay, with the help of this glucose tolerance curve, we can predict whether the person is having diabetes or not. Okay, so the three possible glucose tolerance curves are, we can predict whether he is normal. Okay, so for that, if the person is going to fall in this category of normal glucose, means glucose value of 70 to 110 mg per dl, means he falls under the category of normal glucose tolerance curve. Okay, so we can have three types of curves like normal glucose tolerance curve, impaired glucose tolerance curve, and diabetic glucose tolerance curve. Okay, so in the normal glucose tolerance curve, the fasting blood glucose will remain within the normal reference range, that is 70 to 110 milligram per dl. So the fasting 0 minute sample, okay, that will be between 70 to 110, and the blood glucose level will increase greater than, okay, will increase it will increase from 75 to 140 milligram per dl. Okay, so within 1 hour we can have the values from 75, it will increase to 100, then it will increase to 140. So it will not increase beyond this 140. In the case of normal persons who is not having any diabetics, the glucose tolerance curve, that is the blood glucose level, will fall within the range from the fasting sample should be within the range of 70 to 110, and at 1 hour interval the blood glucose level will be less than or equal to 140 milligram per dl. Okay, so after the glucose load the value will be less than 140 milligram at 1 hour interval, and the increased blood glucose level will return to normal within 2 to 2.5 hours. Within this 2 to 2.5 hours, the increased 140 milligram per dl will comes to this normal fasting range. Okay, so this type of curve obtained is called as normal glucose tolerance curve. So the blood glucose value should be plotted against this time interval of 0 minutes, half an hour, 1 hour, 1.5 hour, 2 hours, 2.5 hours, like that. You have to plot a graph, and we can predict whether he falls under this normal glucose tolerance or is going to have diabetes. Okay, so this is the curve for normal patients. Okay, then impaired glucose tolerance curve. So for the persons who have impaired glucose tolerance, the blood glucose will remain from 110 to 140. So the fasting sample level itself will be in the range of above the normal value. The normal reference value is 70 to 110. For the impaired glucose tolerance curve, the 0 minute sample, the fasting blood sample itself will start from 110 to 140 milligram per dl, which will increase to greater than 140, and it will reach more than 140 to 200. It will be in the range of 140 to 200. So it will increase from 140 to 160, 180, like that, and it remains between the level 140 to 200 milligram per dl after 1 hour of glucose load, and this blood glucose level will cross the renal threshold value. So the renal threshold value is 160 to 180 milligram per dl. So if the level if crosses this 180, glucose will start appear in the urine. Okay, so these persons will have urine sample also simultaneously collected at each interval to check for the presence of glucose and ketone bodies. Okay, for the normal patients there will not be any glucose and ketone bodies in the urine sample, whereas in the case of impaired glucose tolerance curve, okay, in the persons who have this impaired glucose tolerance curve, the sugar level will reach more than 200 milligram per dl after the ingestion of glucose. So the renal threshold level is 160 to 180. So as glucose starts appears in urine. Okay, so these impaired glucose tolerance curve patients may slowly develop into frank diabetes within 5 years. Okay. Next type of curve is called diabetes curve. Glucose tolerance curve for diabetic patients. So in the case of decreased or poor glucose tolerance, which is shown mainly by the diabetic patients, type 1 or type 2 diabetic patients, the fasting blood sugar sample will be greater than 140. So the 0 minute sample itself start from either from 200 or 250, like that. It's the starting value itself will be more than 200 milligram per dl, and after 1 hour interval it will increase more than 300, 340 and 350, like that. It will keeps on increasing. Okay, so it will increase the 1 hour sample will be always, it will be increased from 200. Okay, so it will reach more than 200 milligram per dl in the case of Okay, in the case of severe diabetic, and in the case of severe diabetic, this oral glucose load will never return to normal within 2 hours. Okay, so within 2 hours this level will not reach the normal value. So that in that case we can confirm that the person is suffering from diabetics. The patients will excrete glucose in urine sample, and ketone bodies will also be detected. So you'll show in the fasting sample itself. So from this glucose tolerance curve and urine, we can predict the glucose, whether the person is having diabetic or pre-diabetic or normal is normal. Okay, so for the in the case of normal patients, urine sample will not show any glucose or ketone bodies. Okay, from the 0 minutes, half an hour interval, 1 hour, 1.5 hours, 2, for every time interval if you check also, there will not be any glucose detected, and ketone bodies also will not be present in the case of normal persons. Whereas in the case of persons who have shown impaired glucose tolerance curve, he will not show any glucose in 0 hour and half an hour interval. At 0 hour and half an hour interval, he will not show any glucose in urine. Whereas in the 1 hour time interval, where it reaches the maximum of 180 milligram per dl, that times glucose starts appears in the urine sample. So at 1 hour interval, he will show glucose. Okay, excretion of glucose at 1 hour interval, then it will come to normal. It will come back to normal in the case of impaired glucose tolerance curve. Whereas in the case of diabetic curve, whether he is severely diabetic or moderate diabetic, from the 0 minutes, that is the fasting sample itself, glucose will be present in the urine sample. Glucose and ketone bodies can be detected in the urine sample, and if you check the presence of glucose and ketone bodies in urine sample, it will be present in all the samples collected for half an hour interval or 1 hour, 1.5 hours. For all the intervals, you can find the presence of glycosuria, that is excretion of glucose in urine. Okay. The fasting blood glucose level is 70 to 110 milligram per dl, and the postprandial value is greater than 140 milligram per 100 ml, which are considered to be normal. And according to WHO, greater than 140 milligram per 100 ml in the fasting state, and greater than 200 milligram per dl after the glucose load, that is postprandial state, is said to be included under the diabetic condition. Okay, these impaired glucose tolerance curve patients may slowly develop into frank diabetes within 5 years. Renal threshold value for glucose is 160 to 180 milligram per dl. Okay, most of the diabetic patients will exhibit glycosuria because the blood glucose level is more than 200 milligram per dl. This is due to the raised renal threshold value of glucose. Thank you. Thank you for watching this video. Subscribe and support the channel Biochemistry DSP.